This video has been made to help you run your practice during COVID-19. Dr. Statulis has prepared an information sheet for you and your staff. You should reduce consultations to those that are necessary and use telemedicine if possible. The document also contains information about running your practice remotely. Please study the document as there is a lot of information that you may find useful. Reducing paper contact in practice is vital. Your office door should be open to avoid patients touching door handles. The patient should arrive with a mask and screening sticker. You must have hand sanitizer available. Ideally, the patient should have emailed her information prior to arrival. Notice the Perspex screens. An easy way to capture referral letters or medical aid information is for the receptionist to take photos and email them to herself for use in the patient's file. The counter surface should be cleaned after each use. The patient may now take a seat. Notice that she cannot touch anything in the rooms. All magazines and pamphlets have been removed. Notice also the signs separating seating spaces to keep social distance. The doctor will be required to wear a surgical mask and visor and a disposable apron for each patient. Notice there is no touch between doctor and patient until the examination is required. The doctor has a Perspex shield on his desk and after taking a history can ask the patient to take a seat in the examination room. Notice that the couch does not have any linen so that the vinyl can be cleaned between patients. Remember hand hygiene. The doctor should don gloves for the examination and afterwards must wipe down the vinyl with a MediWipe or fresh daily mix of 1 part Jik to 2.5 parts water. The apron and gloves must be discarded and notice that your bin should be open to avoid touching the outer surface. Remember hand hygiene. Your in-office workflow with the patient will change. You should avoid giving the patient printed or written matter, but rather email documents to them or to the service provider. You can complete a laboratory form and send a photo of it to your receptionist who can forward it to the laboratory. Even giving out a business card is difficult, and you should consider creating a QR code to share your practice information and contact details. Dr. Statulis is happy to help any practitioners with this information. Thank you also to Pumza, who is Kingsway's Patient-Centered Care Liaison Officer, and to Anina for starring in the video.